but we need more vaccine. We are limited by the amount of vaccine that we have received.
Tonight, there is a lot of frustration from people over when they will be allowed to get the coronavirus vaccine. And here in Nashville, officials are warning neighbors that the vaccination is a long process.
Nashville officials say the state receives about 80,000 COVID-19 vaccine doses every week. The city receives about 5,300 doses a week. And so far, Nashville has given out 54,000 doses of the vaccine, which includes 5,000 in second doses. There is a stark reality, though, for people who want to get their loved ones vaccinated who are among the highest risk of dying from that virus.
Yeah, we want to go now to our chief investigative reporter, Jeremy Finley. So, Jeremy, you really found out exactly how long this process is going to take.
Yeah, that's right, Brittany, Tracy, and it all comes from a town hall meeting where members of the AARP could call in to not only hear directly from the governor and his commissioner of the Department of Health about the vaccine rollout, but also voice their concerns about it. As part of this meeting, they got a stark reality check from the commissioner herself.
When this first began,
with the kind of access usually reserved for reporters, members of the AARP are asking questions directly to the state health commissioner about the vaccine rollout, not holding back about trying to email
over a week ago, never got a response,
and call about getting an appointment.
I've been calling to the East Tennessee phone number for the last 3 weeks to get an appointment, never even got through, just getting a little frustrated that here we are in this very accelerated age bracket and wondering, when are we going to get an appointment?
I apologize you've had trouble.
The commissioner is also being direct, describing the situation at hand this way.
When the demand is so far over the supply, there are going to be some people who we can't get to everyone immediately.
Here's the reality. The state health department estimates 450,000 Tennesseans are above the age of 75, but the state is only getting 60,000 doses a week sent into communities. It means at this pace, it will take more than a month and a half to vaccinate everyone in that age bracket alone. But there's also conflict among the state's older population. 68-year-old Patricia Wilson says her generation should simply wait, and the vaccine given to those who must go out and work.
They don't have a choice. We have a choice, and the choice is stay home.
As for those who feel they can't wait, the commissioner says for now, they may have no choice.
I encourage you to continue calling. And please be patient and give us some grace. We're trying to do the best we can with the very limited supply.
Now, the commissioner did say that she hopes that the state's new system of letting seniors set appointments to try and get the vaccine will help give them that knowledge that when exactly they will get it. But it's also important to note, we're only talking about here the doses for state-run public health departments. That, of course, does not include places like Davidson County. Tracy?